Hi, you found Therapy Connections, and I'm Shara. Today I'm going to talk you through what trauma processing is. Trauma processing is this term that I hear a lot when clients come in to see me. A lot of people hear that what needs to happen after you've been through trauma is that you need to do trauma processing. Go into a therapist, process your trauma, and that means that you'll heal from it. But most people don't understand what trauma processing is and can be a little frustrated with the process when they come in. So today I'm hoping to give you a little more information about what exactly trauma processing is so that you know what to expect when you go in to see a trauma therapist. So first of all, going through trauma doesn't necessarily mean that you need treatment. The thing that determines whether you need treatment for your trauma is whether experiencing that trauma is currently affecting you in a negative way. So this means that you notice two separate things. One, that your body is having specific reactions to the trauma that you've been through, meaning that you notice that you maybe feel like emotionally dysregulated, or you're having times where you have nightmares or flashbacks, or feel like you're back in the space of that trauma again. Those are body reactions to the trauma that indicate that treatment would be helpful. The other thing that people often notice as an outcome or a negative experience that follows a traumatic event is that sometimes we have thoughts about ourselves or about the world around us that are based on the trauma. So let's say you've been through something traumatic and somebody else has done something bad to you. Often people notice feeling and thinking things about the world not being trustworthy, us not being able to have good, healthy relationships, thoughts like that circle around our heads. So if you've been through something that you would consider to be traumatic and you notice the thoughts that are becoming a problem and different body reactions, then trauma processing actually would be a good choice for you. Now, here's the part that people mostly don't realize. Often when a new client comes in to see me and knows that I treat PTSD, they'll say to me like, hey, look, I'm here for trauma processing, so here's what I went through and I'm ready, like let's just process through it. Often people don't know that it isn't a matter of just jumping in and talking about the trauma and then suddenly you're going to feel differently about it. Trauma processing has a couple of different phases and a couple of different goals that have to happen. So remember a second ago when I talked about the fact that this affects your cognitions or the things you think, but it also affects your body. Both of those things have to be treated, and sitting and talking about your trauma doesn't treat all of the body reactions that you're experiencing. Instead, in trauma therapy, you're going to have to deal with both, which means, sure, there may be some talking, but there also is going to have to be some work with your body to help your body get back to a space where you're better regulated. So in therapy, if you go into therapy and you say, I'm ready to process trauma, and you go in and you just sit and talk about all of this trauma that you've been through, chances of that helping you is not very good because your body already has this sitting in it in a very specific way. So you may be actually even re-traumatizing yourself by going into the therapist and just telling and talking about all of these things. Your body might be still having this reaction while you're verbally walking through the trauma that you went through. So in trauma therapy, the first thing that has to happen is that you have to learn more about how to regulate your nervous system and learn ways to help your body calm back down when there is a trigger that's happened. We have to help you find ways to treat the part of your nervous system that you don't really have conscious awareness of. And this is a bit of a process. For some people, If you have had a pretty well-regulated nervous system and maybe just experienced one traumatic event, this process might be a pretty short one. For other people who've had chronic or long-term trauma, learning how to better manage and regulate your nervous system can take quite a long time. You may be in therapy for several months, maybe even a year or more, before you ever start working specifically on that traumatic event. Now, that doesn't mean you're not doing any processing of your trauma. Instead, what you're doing is you're learning how to manage some of the body responses around this before you actually go into some of the narrative or story, if you will, behind what happened. Trauma processing is only complete when you have learned how to manage both your body responses and you've learned how to manage some of the cognitive responses, and you've been able to help your brain and body process through or reprocess what it is that has gone on, so that you keep some understanding and knowledge that you gained of the experience, but that your body is not keeping all of the exact same reactions that it's had in the past. In my practice, I really like to do this using EMDR, and that's a kind of therapy that does some of both of this. You're dealing with both your body responses and the things that you think about the trauma. There are other kinds of therapy too that can be very helpful, and so if this is something that you feel like you could use some help with, it's a great idea to talk to a professional about. But I would also do a little bit of research. Make sure that you're not doing a therapy that only focuses on one or the other. There needs to be processing of both things. Hopefully it was helpful to hear some of this information. If you liked this content, like and subscribe, and we'll be able to get you some more content like this.